Hello guys, this is me Dr. KQ today here, and we will discuss today the previous lecture. We will continue the previous lecture of history taking, in which we have discussed the three basic points of history taking. Number one was identifying data, then we have discussed the chief complaint, and finally the history of present illness. So that was all about the basic steps of history taking. Now we will continue the process of history taking, in which the first one we will discuss here is the past medical history, then we will discuss the medication history, and finally personal history. In past medical history, you will start by asking the patient if they have any problem. If you will receive little or no response, then you will ask the following questions. Number one we will discuss here is, have they ever received any medical procedure? Starting from the first one, that have they ever received any medical care? If so, what was the problem addressed or what was the issue addressed at the time? Was the medical care continuous or episodic? The second thing is, was the care continuous or episodic? Then you will move forward and you will ask another question, that have they ever undergone any medical procedure like X-ray, CT scan or MRI, etc. You will ask, have they ever undergone X-ray, MRI, CT scan, etc. Then you will move forward and you will ask, have they ever been hospitalized? If so, you will ask the reason for it. If they don't know the name of a procedure or operation, you should at least try to ask about the procedure, why it was performed. So this is all about the past medical history. So in past medical history, you will ask these things. Next, you will move forward in the medication history. In medication history, you will ask definitely about the prescriptions of a medicine they are taking. And here is another important point you will ask in medication history, that is the dose and frequency of the medicine. You will ask about these two things. Then you will ask why they are being treated. You can also ask, do they know why they are being treated? Have they experienced any adverse reaction? Regarding adverse reaction is the important point. Adverse reaction regarding the drugs or a medicine they are taking. So these two are the important points. You should ask about the nature of adverse reaction clearly regarding that medicine. Next, you will ask about the personal history, which involve the smoking, alcohol, work, hobbies, and other personal information as well. In smoking, you can ask about, have they ever smoked cigarette? If so, how many pack per day and for how long they are smoking. Regarding alcohol history, you can ask, do they drink alcohol? If so, how much per day? And if they are not drinking alcohol on a regular basis, how much they consume in a week or in a month. So these are the questions you can ask in the alcohol. In alcohol, you can also talk about the type of drink they are taking in. So these are the things you will discuss in the alcoholic patient. Next, you can also ask about the work, hobbies, and the other personal information as well in the personal history. These are the three things we have discussed. Now we will move forward towards the review of the different body system, in which we will discuss about the respiratory system, CVS, CNS, hematology, endocrinology, breast, etc. We will discuss these systems step by step. We will discuss here the number one, that is respiratory system. Review of the system is the inquiry about all the physiological systems of the body. In review of the system, you will go in detail about each and every system of the body, but you will describe in detail about only the system which is pertaining to patient's problem. So always discuss the system which is pertaining to patient's problem. Starting from the first one, that is respiratory system. Before going to discuss the respiratory system, here is another thing I want to add, that is constitutional symptoms or general symptoms. We call them general symptoms, which includes the weight, either it is increasing or decreasing, or it is stationary, weakness, fever, either it is intermittent, continuous or remittent, with chills or without chills, malaise, heat and cold intolerance, increase or decrease in the appetite. All these are the symptoms you should ask before going to discuss in detail about any system. So I have discussed these constitutional symptoms. Now we will start from the respiratory system. Respiratory system is the system which involves the problem regarding the respiration. Respiratory system involves, number one here is the cough, which is the indicator of any problem regarding respiration. Then we will discuss the sputum. Then third one here is the hemoptysis, then chest pain, dyspnea, hoarseness of voice. All these are the things we will discuss in the respiratory system, because these are the indicators for respiratory system problem. So starting from the first one, which is cough. Cough may be moist and it can be dry. It can be short and prolonged. So we will discuss here the cough which may be short plus dry, which is indicating the upper respiratory tract infection, or there is a early stage of the pneumonia in which the cough will be short and dry. The second one here is the prolonged or repetitive cough plus moist or productive cough, which is indicating a problem of the respiratory system, which is chronic bronchitis or bronchiectasis. So cough is the indicator for different respiratory problems. If there is a cough plus wheezing sound, then the patient is with airway obstructive problem. Moving next, if the patient is having violent fits of a cough and inspiratory stutter or whooping, then this will suggest the problem we call pertussis or FB inhalation, foreign body inhalation. Finally, here is the nocturnal cough in children. This is the indication of asthmatic patient. So cough is basically giving clue about any respiratory problem. Moving next, we will discuss the sputum. Here comes the second one, which is sputum. Sputum is also indicator for different respiratory problems. So in sputum, when we will go for the macroscopic examination, we are actually including, number one here is the quantity of sputum, color, consistency and smell. So these are the things we will see in the macroscopic examination of sputum. So regarding color, color has its diagnostic value. Color of the sputum is actually having some diagnostic value. So we will discuss here the color of sputum. Green color indicates the pus arising from bacterial infection, which is very important to know. The second one here is yellow sputum, which is indicating due to pus, or it may be due to the presence of eosinophils in the allergic states like asthma. Then comes the brown color, which is indicating the fungal infection, or it may be due to the amoebic liver abscess, which is rupturing into the lung. So it is also giving the brown color. Then comes the greenish yellow color, which is due to the bronchobiliary fistula. Then comes the last here, thick viscous tenacious sputum. This is regarding the consistency we have discussed here. Third one, which is consistency of the sputum. This is regarding the consistency of the sputum, which has its therapeutic value. Thick viscous tenacious sputum is indicating acute severe asthma. These are the points or question regarding sputum we should ask from the patient. Now comes the hemoptysis. Hemoptysis is the presence of blood in sputum. Coughing up of our blood in a sputum is one of the most alarming and critical situation, but before going to discuss in detail, you should know either it is coming from nasopharyngeal tract, or either it is from respiratory tract, or it is coming from gastrointestinal tract. So regarding hemoptysis, you should know the difference between two words, the hemoptysis and hematemesis. Hemoptysis is the word I have discussed, that it is the presence of blood in a sputum, while this hematemesis is the vomiting of a blood. You should distinguish between these two words. In hemoptysis, the color of the blood is bright red and it is frothy, while the color of blood in hematemesis is dark and brownish. Now comes the chest pain. In chest pain, we will discuss that either it is arising from pleura, or either it is arising from chest wall or from tracheobronchial tree. Lungs itself are insensitive to pain. Pain usually arises from pleura, chest wall, or either it is arising from tracheoesophageal tree. So here comes the first one, which is pleuritic pain or pleuritic chest pain, the causes of which includes the TB, cancer, pulmonary infarction or pneumothorax. So the pleuritic chest pain is a sharp stabbing and it is related to inspiration. While inspiration, this pain is usually felt. The second one here is chest wall pain, which is related to respiratory disease or it is due to musculoskeletal disorder. Then comes the pains which are of non-respiratory origin. The pain which is retrosternal burning pain is due to acid reflux into the esophagus after meal or after lying down or stooping forward. So this is the pain due to acid reflux. Next comes the retrosternal gripping pain. This is due to the angina, which is usually occur due to an effort and it radiates towards the neck, jaw or towards the back. So these are the pains which are felt in the respiratory problems. These are the points or questions regarding the respiratory pain you should ask from the patient. Next, we will discuss the dyspnea and hoarseness of a voice. Here comes the last two indicator of the respiratory system. Number one here is the dyspnea, then is the hoarseness of voice. Dyspnea is a need to breathe more. It is due to the increased demand or due to the impaired performance or combination of both these. Sensation of dyspnea can be explained in a different ways like shortness of breath, difficulty in breathing in and out, suffocation, feeling puffed. All these are the terms that are describing the dyspnea. Then comes the hoarseness of voice. This involves the recurrent laryngeal nerve. Due to the involvement of recurrent laryngeal nerve in a patient of superior vena cava syndrome, there will be the heaviness of the sound, that is not the hoarseness of a sound, which is due to the edema present in the vocal cords. So this is the problem I've discussed in the hoarseness of voice. These are the all points indicating the respiratory problems. Next, we are going to discuss the CVS, and I think review of the system is taking much time. We have still discussed only the respiratory system. Now we will discuss the CVS, then we will go for the endocrinology. So these are taking much time. We will discuss these system step by step in next videos. Hope you like my video. Thank you very much for watching. I'll see you in my next video.